Good morning, ladies and gentlemen. Welcome to Kim Fon Dermatology Classroom. Moving on next, I would like to preview another lecture on atopic dermatitis. In this particular preview, I would like to empower the parents how to decide when to put moisturizer, when to taper the steroid, and where to put the tacrolimus and pimecrolimus. In order to achieve that, first and foremost, they need to have the confidence to recognize eczema of different degree affecting different skin of color. A lot of people has underestimated the presentation of eczema and the difficulty to assess eczema activity. Eczema does not have one single image, in fact has many images to represent eczema. As you look at these 12 images, all of them look very different, but all represent different degree of skin inflammations. Some have chronic eczema, some have acute eczema, some affect skin of fair color, some affect skin of darker color. So in short, eczema has many phases of presentation. So we need to be able to recognize the different stages of eczema from acute, subacute to chronic. In fact, if you don't stop the eczema progression at this point, they will further evolve into prurigo nodular stage. To complicate this further, there's a stage just precede the onset of redness, which is subclinical eczema. Subclinical eczema referring to a stage in which if you look at the lesion that looks quite normal, but they already start to feel itchiness. If you take a biopsy at this stage, you will get the microscopic inflammation. You take a probe over the skin there's an auto skin pH increase in transepidermal water loss. In fact, we always say eczema is the itch that rashes, means that eczema is a condition in which you sense it first before you can visualize it. And this makes the assessment of eczema activity very difficult for inexperienced caretaker. Generally, we divide our patient into two groups. The first group has fairer skin. Indeed, among the fairer skin, the skin redness is a reliable clinical sign for early eczema, together with the itchiness. For darker skin, they need more steps to assess the eczema activity, whether the onset or into remission. First, we ask them to visualize. Next, we ask them to close their eye to feel for the scaliness, lumpiness, and lichenification. Thirdly, we ask them to meditate to feel for the itchiness. And these are the three steps for the darker skin, and for the fairer skin, the redness in fact are quite useful. Once you have assessed it, we need to further highlight to the parents that eczema does not come according to all or none assessment or rules. Eczema usually takes time to slowly accumulate the fire of inflammation from 0 to 3 to 5 to 7 to 10. So it means that it does not come suddenly like urticaria. It takes time to build up the fire. One of the analogy that are often used to describe what eczema is all about is we use the skin represented by the house and the fire represent the degree of skin inflammation. Often, before the fire comes out from the rooftop, they're often preceded by a stage in which the smoke billowing out from the rooftop. When you get a bit nearer, you feel the heat from the house. This suggests that the house is already on fire. Of course, a lot of parents in terms of eczema, they are too late in identification of this stage. They have to wait until the skin get blisters or get secondary infected in the final stage of the eczema. If a patient always walk in with infected eczema, it means that you have not properly educated the patient how to recognize early eczema and put out the fire promptly. So as already highlighted earlier on, before the onset of redness, there's a stage called subclinical eczema, in which the inflammatory cytokines, inflammatory cells are infiltrating under the skin. By knowing different degree of eczema, the concept of subclinical eczema, the steps to assess the eczema activity, now it's time for you to practice on the real patients. If you don't educate them, most of the parents might just apply the steroid over here and moisturizer over the other areas. It's not correct, because indeed it's true at the center the fire may be degree of 8 to 9, but it does not stop abruptly. They have an ill-defined margin of clinical eczema to subclinical eczema before they enter into just dry skin with no obvious inflammations. So these are the maps of eczema activity. And by knowing that, the next step you need to decide, you have enough information to decide what kind of combination that you want to use over those areas. Whether you just use moisturizer, steroid with tacrolimus or pimecrolimus. And this all based on the age of patient, the financial background, the chronicity of the lesions, etc., etc. So after you have mapped the area of eczema, subclinical eczema and skin dryness, then we can start applying the steroid. Of course, over the center, we can put steroid in the morning, but in the evening, over the area with higher inflammation, you can add on another dose of either steroid or tacrolimus and pimecrolimus. And in terms of emollients, you can put as liberal as you want, so long as you feel the itchiness and scaliness and dryness, you can put moisturizer over this area. And subsequently, we decide about the sequence, follow up at taper, and re-emphasize the parents. You want to know more about this 3-step, please join www.pediatricdermatology.com.my. With this, I would like to thanks for your attentions.